say, first of all, thank you to Nicole for inviting me. Thank you all for coming. It is a big subject. Usually the presentations that I do on this subject are a lot longer than 15 minutes. So this is a little bit pared down, and I'm going to try not to rush through. Again, it's difficult to know how many of you work with people who came through the protection stream into Canada on a regular basis. So these would be refugee claimants, refugees, and people who have been refugees in the past. I know not all of you probably do, but I will assume that some of you do. So I think that it's helpful to start out with a definition of what the Interim Federal Health Plan is. And what it is it's basically health insurance for people who came to Canada and claimed refugee status, or who arrived already as refugees and who are not yet eligible for ODA. Because as you know, you have to be here for 3 months and have status in order to be eligible for ODA. This insurance covers refugee claimants. It covers privately sponsored refugees. So these are people who are brought in by church groups or other organizations as refugees. It includes government-assisted refugees, so people that our government selects in camps overseas and then brings over. And it also includes victims of trafficking who are here on temporary residence permits. Now, when I say that it includes refugee claimants, the IFH also covers people who have had their first refugee hearing, and were denied as refugees, but who are appealing that decision. So if they're still in the process of appeal, they should still be eligible for a basic form of health care, unless they're coming from designated safe countries, and I'll get into that a little bit later. So most of these changes took effect on June 29, 2012, and before that date, the services that were covered under the IFH included the services of doctors, nurses, hospital services, and diagnostic and ambulance services, plus a number of supplementary benefits. So, for example, some medications were covered, people had limited dental and vision care, prosthetics and devices to assist mobility were covered, home care and long-term care, psychological counseling, and post-arrival health assessment. Now, most of these supplementary benefits that were provided were in line with what would have been provided to non-refugee claimants under the OW. So if they were on income assistance, they would have received most of those through income assistance. What changed in June is that a lot of this funding got cut. Right? So protected persons, convention refugees, and refugee claimants who haven't had a decision yet and who are coming from non-designated, so non-safe countries, no longer have access to the supplemental healthcare benefits. Right? So all the supplementals were cut, and perhaps most importantly for us here today, the psychological counseling aspect was cut. Now, at this point, it might be helpful to explain what I mean by claimants from non-designated countries. We now have sort of two streams for refugee claimants. People who are coming from most countries in the world, and then people who are coming from countries that the government believes are safe and should not be producing refugees. So currently that list includes most countries in the European Union, the US, Australia, the UK. It also includes Mexico, Hungary, and several other countries. So people who are coming from those countries and are still claiming refugee status when they arrive are not even eligible for this basic level of care that other refugee claimants are getting. Everybody else, all the other refugee claimants, continue to be entitled to the services of doctors, nurses, hospital services, diagnostic and ambulance services. Medications and vaccines would be provided for them through the IFH only if they're needed to prevent or treat a disease that is a risk to public health or safety. Okay? Now, it should be noted that for a lot of people, they will still be covered for some medication through Ontario Work, through the supplemental programs there, but some others are not. those refugee claimants who are coming from the designated safe countries and also rejected refugee claimants who either are not appealing that decision or who've exhausted their right of appeal are not eligible to any medical care unless it's needed in order to prevent a risk to public health or safety. So I know that this is getting terribly complicated, but basically what it means is that if you're dealing with somebody who's either coming from a designated country or who's had their refugee claim rejected and is not appealing that decision, or their appeal was rejected, basically they will not be able to access health care unless they have a condition that threatens others. So example of a condition like that might be tuberculosis, it might be HIV/AIDS. If that person just had a broken leg or if they had chronic heart disease, they would not be able to access health care for that. It should also be noted that refugee claimants who have withdrawn or abandoned their claim, or people who were never eligible to make a refugee claim but who went right through to the pre-removal risk assessment stage, are not eligible for any health care whatsoever. Okay, so even if their condition threatens public safety, they are not entitled to health care under the IFH. And the way that this might happen, for instance, is that it occasionally happens that refugee claimants forget to inform Citizenship and Immigration Canada or the Immigration and Refugee Board about a change of address, or they don't know that they should be informing them. So that the letters notifying them of a hearing coming up would not arrive at the correct address. Often in that situation, their claim would be declared abandoned. The minute that happens, they lose all health care. Another way that this might happen is if somebody has, their claim has been, they believe that their claim will be rejected because their country has a low acceptance rate at the Immigration and Refugee Board. So they say, okay, I'm just gonna go home. You know, I give up, I'm just gonna go home, I want to withdraw my claim. The minute they do that, they will lose all health coverage. The coverage that has not been affected, that has not been cut, is coverage for victims of human trafficking, for government-assisted refugees, so these are people that the government brings over from overseas refugee camps, and for privately sponsored refugees who are receiving income support through the resettlement assistance program. So those are people who are privately sponsored, but are still getting a government supplement. Okay, so these people will have access to everything. They have access to the basic services, and they have access to all the supplementary benefits that they would have in the past. It's a very, very small group. If I was going to summarize all of these changes for you, because I know it gets quite complicated, I would say most refugee claimants, until they've had their hearing, will be eligible for basic emergency health care, but not for any supplementals. People from designated countries will be eligible for almost nothing unless it threatens public safety. Those are the two things that you can take away from here. I wanted to spend a little bit of time speaking specifically about the implications for mental health of this. So the first thing I wanted to tell you is that, as I've pointed out before, counseling services are no longer covered, except for a very small group of people. Those are the government-assisted refugees, victims of trafficking, and privately sponsored refugees who receive income support. Okay? Everybody else, all other refugee claimants, are no longer eligible for counseling services. So one of the ways that this has impacted some agencies is that in the past, for instance, as part of helping somebody prepare for a refugee claim, if you knew that your client was going to go in and testify about things that had happened to them, like rapes back home, and that they had a lot of difficulty speaking about these issues, you would be able to refer them to a registered psychologist for counseling to help them actually be able to speak about what happened to them. That's no longer available. Okay, so that's something, so if you're dealing with traumatized clients, that's something you need to be aware of. Now, psychiatric services should still be covered for most refugee claimants from non-designated countries. Okay? So for people who are not coming from the safe countries, if they have a psychiatric condition, they should still be able to get that coverage. Mind you, the medications are not covered for that, right? Because medications are no longer covered unless there's a threat to public safety. Again, for people who are coming from designated countries, as well as those who've had their refugee claim and either are not appealing a negative decision or whose appeal has failed, they will not have access to the psychiatric services unless providing such services is in the interest of public health and safety. So the way that this may play out, for instance, is if you have somebody who's just had their refugee claim rejected, if they have major depression, they will not be eligible for psychiatric services. But if they have schizophrenia, which could be a threat to the public, they would be eligible. So it gets a little bit complicated there. And finally, again, claimants who withdrew or abandoned their claim have no coverage at all for anything. I wanted to talk a little bit about what the challenges that we've been seeing as service providers since these changes came into effect. One of the obvious changes is that because there's now more uninsured people, there's more pressure on those places that do serve the uninsured, right? So for example, hospitals are not allowed to turn people away in emergency situations. So increasingly people are going to hospitals if they can't go anywhere else. So hospitals are seeing more higher levels of uninsured people. And because they are having trouble coping, increasingly they're trying to charge the people who come if they don't have insurance, right? So this can be problematic for refugee claimants who have no sources of income. Advocate on behalf of your client and explain to the hospital why they need to be seen. The second thing that we've been seeing since these changes came into effect is that eligible claimants are being turned away from services. This is because the system is so complicated, and I'm only giving you sort of a taste of it, but it is really quite complicated, and a lot of service providers can't easily figure out whether somebody is eligible or is not eligible. And especially private medical practitioners just prefer not to have to deal with it sometimes. So more people are getting turned away, especially from private practices. The other thing that's happening is that even if the practitioner knows that the person is eligible, they may still not want to take them because they're worried that the coverage will end. So for example, this has come up a lot with pregnant women trying to access care. If they go to an obstetrician, often the obstetrician will turn them away saying, yes, you may be covered for this because you're a refugee claimant now, but if you fail your claim, you'll be cut off, and I can't fire you as a patient at that point for liability reasons. So it's become much harder to get those services, even for those who are eligible, which means effectively that those people are also ending up in the same line as everybody who's uninsured. And finally, this is more of a glitch in the system, and I don't know whether it's going to get resolved or not, but we have had issues with eligible claimants not showing up in the IFH system quickly enough. So what seems to be happening is that the idea is that if your refugee claim has failed, within 2 weeks, your IFH coverage is cut off. If you appeal, you should stay on the IFH system. But I think that sometimes that information may not be getting through to CIC quickly enough, because we have had cases of clients who are legally eligible being told by their medical practitioners that they've called CIC and CIC told them they're not in the system. So there seems to be a sort of a delay in how quickly the system is able to update eligibility, and it means that people are being turned away from care. So what can we do as settlement workers? First of all, if you know that somebody is eligible, you can try to advocate for them with their health service provider. And that means that you will have to go to the Blue Cross website, and I included the link there. I'm happy to email out this presentation to Nicole afterwards. And you will have to go into the eligibility criteria and be able to argue why that person should have coverage. I'm not sure how successful that will be, because according to the CIC guidelines, the doctor has to verify with CIC that somebody's eligible. So if they call CIC and CIC says no, probably you won't have that much success. You can also help. There's a list online now in a Google Cloud of resources that are available for uninsured clients across Ontario. So this includes not just refugee claimants, not just failed refugees, but anybody who for whatever reason is not eligible for other health care. And if you follow that link, it has a list of clinics and drop-ins and services that are still available for people. Now, again, those services are getting very overwhelmed. The final thing that you can do is, in an emergency, you can refer them to places that will not turn people away, right? So hospitals may try to turn somebody away if they're overwhelmed. If you go with the person, if you're able to advocate, usually they will take them. Walk-in clinics for the uninsured. Drop-ins, homeless shelters, they sometimes have doctors who come in and provide services. Midwives have said that they actually will provide services to uninsured people. So for women who have been cut off for prenatal services and so on, you can use the midwife services, who are then able to sometimes advocate on behalf of that person with doctors. And finally, there are some specialty services around, like the CCBT, which provides counseling for victims of torture, like Barbara Schleifer, which provides counseling for women victims of assault. Again, those are sort of meager resources in the community, but they do exist. And also, I just wanted to say as a final point, is that in exceptional cases, it may be possible to advocate for clients by petitioning CIC for a special exemption. Now, I'm not sure how successful you will be, especially if it's an urgent case. I'm not sure how likely it is that you'll get a response quick enough, but it is something that people are trying. And if you want to go this route, if you have a particularly drastic case, you could consider contacting some of the advocacy groups, like Canadian Doctors for Refugee Care or the Health for All campaign. And I'm told that I'm out of time, which is good because I'm finished.